Honourable Senators, I rise today to speak to Senator Kutcher's proposal for the Senate Social Affairs Committee to study the federal suicide prevention framework according to the specific criteria he lists in his motion. These include an evaluation of the framework's effectiveness, an examination of rates of suicide in Canada as a whole and in unique populations, a report on funding and the evidence-based criteria for the selection of each initiative under the framework, the evidence of a, quote, demonstrated significant, substantive, and sustained decrease in suicide rates in the population targeted, quote, proposed recommendations to ensure the framework and federal funding for suicide prevention activities are based on suicide rate reduction, and a requirement that the committee report be sent back to us in the Senate no later than December 16, 2022. One of Senator Kutcher's primary concerns with the current federal framework for suicide prevention seems to be that he is seeking to know the quantifiable scientific effectiveness of the activities that have been implemented as part of the framework. And I can't help but notice that content of this motion is somewhat similar to two studies Senator Kutcher published before his arrival in the Senate. The first, from 2016, was entitled, quote, School and Community-Based Youth Suicide Prevention Interventions, Hot Idea, Hot Air, or Sham, quote. And the other one, from 2017, called, quote, Suicide Prevention, Doing the Right Thing is Not the Same as Doing Something, quote. Both studied popular suicide prevention programs, and both concluded that those particular programs could be ineffectual and, in some cases, even possibly harmful. I assume it is these types of programs Senator Kutcher has in mind when he is requesting that the Social Affairs Committee evaluate programs used by the government as part of the federal suicide prevention framework. I'm not sure, though, because throughout his 15-minute speech, Senator Kutcher didn't refer to any specific examples. He spoke vaguely of, quote, those who use the anguish of suicide and the pain and suffering of others to sell, promote, or initiate activities, programs, or products that they claim will prevent suicide but do not, quote, stating, quote, we would like to be assured that the interventions that are being put into place have robust and solid evidence that they worked prior to them being applied, quote. There are no examples in his motion either. Even when I gave Senator Kutcher the opportunity to explain what suicide prevention interventions the Trudeau government had implemented under the federal framework since taking power, he was unsure, saying that he couldn't speak on behalf of the current government and any actions that they have taken. I found that a curious response for a senator who is a psychiatrist and even serves as a mental health advisor to the Trudeau government from time to time. I also remember seeing Senator Kutcher on TV as one of the few guests at Rideau Hall for the swearing-in of the Trudeau government's new Minister of Mental Health and Addictions. Surely, if anyone was aware of what this government had delivered on mental health, it would be Senator Kutcher. If he's drawing a blank, it doesn't say much for the Trudeau government's record of results in mental health and suicide prevention over the last 6.5 years. And since we don't know what the Trudeau government has implemented, it's unclear what the Social Affairs Committee would be studying. Senator Kutcher says, quote, we need to know, but that's the thing, we don't. The motion is too vague to give the committee sufficient direction to know where to begin. Senator Kutcher stated in his speech, quote, we would not condone spending large amounts of taxpayers' money for interventions that had little or no evidence of effectiveness, quote. Still, the question remains, has any significant money been spent on suicide prevention interventions by this Trudeau government? Unsurprisingly, the framework's biannual progress reports from the Trudeau government are scant on detail. In fact, embarrassingly so. The two cursory reports that have been posted online so far basically use the same template and throw a few phrases into each section. This is far beneath what an issue as serious as suicide prevention deserves. Of course, taxpayers' money should be spent wisely, and of course, data and follow-up is important to evaluate the effectiveness of suicide prevention interventions. But we must not lose sight of common sense either. The purpose of creating the federal framework for suicide prevention was to give provinces and regions the ability to share best practices with one another, to not have to reinvent the wheel each time. And some of those ideas might be established programs or activities, but others could be relatively straightforward and low cost. When the bill creating the framework was originally studied, one idea that was proposed at the time was limiting the number of Tylenol pills sold in one container, for example. A simple idea, but one that could actually save lives. I don't think any of us would require a lot of empirical data or prolonged committee study to understand that. I would hate to see Senator Kutcher's motion squelch simple ideas like that by bogging them down in bureaucracy and red tape, resulting in unnecessary delay when instead these ideas could already be in place, saving lives. Senator Kutcher made the argument that suicide is a, quote, emotional topic, but that we must address it with, quote, robust scientific study using appropriate design methods and analytics to measure rates of suicide reduction, quote. I submit we must also be careful not to distance ourselves through the detachment of academia from the very human element at the heart of suicide. At base, we are dealing with people's lives and deaths. Senator Kutcher said in his speech that he's met with survivors and they have looked to him for answers about why a loved one's suicide has happened, and rarely could that question be answered. I disagree. Here's the answer in 90% of suicides: mental illness. And survivors of family suicide need desperately to hear that answer so that they do not forever wonder whether there's something else they could or should have done. As many of you know, I am myself a family survivor of suicide. My late husband, former Member of Parliament Dave Batters, struggled with issues of depression, anxiety, and addiction. In 2008, while still a sitting parliamentarian, Dave chose to go public with his struggle with mental illness. It was revolutionary at the time. The stigma around mental health issues was huge. For public figures, particularly for politicians, mental illness was potentially a career ender. There was no Bell Let's Talk Day yet. The Senate's groundbreaking Social Affairs Committee report on mental health had been published only 2 years earlier. Throughout his illness, Dave and I experienced firsthand the shortcomings in the mental health care system. The gaps were many, and they were exceedingly painful. Tragically, Dave died by suicide in June 2009, 2 weeks short of his 40th birthday. In the spirit of Dave's openness about his struggle with mental illness, I issued a press release about his suicide. While significant stigma still existed around the discussion of mental illness, suicide was even worse, a taboo. Dave's death moved that public discussion forward, out of the darkness. Prime Minister Stephen Harper gave an important address at Dave's funeral, speaking not only about Dave personally, but also about the indiscriminate nature of depression and anxiety. He said, quote, "Depression can strike the sturdiest of souls. It cares not how much you have achieved or how much you have to live for," quote. Prime Minister Harper's speech was unprecedented in addressing the issue of mental illness and suicide publicly and openly. In fact, I know of psychology professors who actually had their students read that speech in relation to discussions of mental health awareness and suicide prevention. In the years that followed, I became involved in mental health advocacy and fundraising, particularly in the issue of suicide prevention. Still politically involved and still close with many of Dave's MP colleagues, I supported Member of Parliament Harold Albrecht's private member's bill to create a federal framework for suicide prevention. I knew that such a framework was one way to help address some of those gaps we had experienced in the mental health care system, and where regions could effectively share their ideas and best practices in suicide prevention with other regions across Canada. I testified before the House of Commons Health Committee in favour of Mr. Albrecht's Bill C-300 in March 2012. His bill was ultimately passed by Parliament in December of that same year, and the Harper government went to work to implement the federal framework for suicide prevention. I was part of the Conservative Government caucus in my first few years that Mr. Albrecht's bill was being implemented. I had frequent conversations with my caucus colleagues, including the Minister of Health, about the suicide prevention framework. As such, I knew the work they were putting in on this file. By the time the Trudeau government took office in 2015, the federal suicide prevention framework had been established to the point where that government should have just been able to take the ball across the goal line. Yet seemingly, they have not. When I look at what the Trudeau government has done on suicide prevention in the last 6.5 years, it appears not much has been happening. Even their mental health advisor can't tell us for sure. I can tell you what the government has been up to during that time, though. Prime Minister Justin Trudeau's crowning legacy achievement has been to legalize marijuana in Canada. While its legalization might be popular in some circles, the frequent use of marijuana is bad for mental health, increasing the risk of addiction and other mental health problems over time, and potentially developing or worsening depression or anxiety. Research shows that these detrimental effects are especially of concern for young people under the age of 25, whose brains are still developing. The other significant change this Trudeau government has made in the realm of mental health is to expand assisted suicide to include people who have mental illness as a sole underlying condition. In fact, it was the very sponsor of this motion before us today, Senator Kutcher, who recommended the legislative change to do that. Senator Kutcher said in his speech on the motion before us today that the government should only fund suicide prevention programs that achieve a, quote, significant, substantive, and sustainable decrease in suicide rates, quote. Well, you know what doesn't help achieve a significant, substantive, and sustainable decrease in suicide rates? Legislating suicide into a state-offered option for those enduring psychological suffering, offering suicide as a rational choice for the treatment of mental illness. That is what this Trudeau government has done for suicide prevention. That is a travesty, honourable senators. The number of people who have accessed assisted suicide since its legalization continues to climb. Nearly 8,000 Canadians received medically assisted deaths in 2020, which was up 17% from 2019. That number was up 26% from the year before that, and none of those numbers yet incorporates the most recent and significant change, that of removing the near-death requirement and expanding access to those with mental illness as a sole underlying condition. I expect between the widening of the criteria to access MAID and the detrimental impact of the pandemic on Canadians' mental health, we will continue to see the number of people seeking assisted suicide climb significantly. Earlier this month, I was dismayed to read a tweet from the British Columbia Aboriginal Network on Disability Society, which illustrated the very scenario I had feared at the time this chamber expanded the assisted suicide criteria to include individuals not near death. It read, quote, "Closed our GoFundMe page today. We were to use the funds to try to assist a lady with disabilities who was not at the end of life, but who chose MAID rather than suffer due to lack of supports. We raised $270. $270 freaking dollars. She died by MAID on February 23rd. She was 51, quote. Leaving Canadians with inadequate supports to meet their needs and then giving them the option of assisted suicide leaves them no options at all. That is the legacy of this Trudeau government. I've spoken at length on the issue of assisted suicide during our debates on the issue before, so I don't want to pursue it further now, except to say that the experience has made me leery of trusting the Trudeau government's definition of whose evidence is considered adequate and whose hand-picked experts are selected to do the peer reviewing. Suffice it to say, while I appreciate Senator Kutcher's quest for transparency from this Trudeau government, good luck, we've been trying it for years, I do think this government should be providing much of this information already via its mandated federal framework biannual report. The Senate Social Affairs Committee shouldn't have to go begging for it. That the government is not proactively forthcoming with this information raises questions about the sincerity of their commitment to mental health and suicide prevention. As I mentioned earlier, suicide prevention isn't just an abstract academic exercise. It's not just something you tweet about twice a year on Bell Let's Talk Day or Mental Health Week. Suicide prevention is vitally important. It's about the saving of lives. That's why I'm concerned that the scope of this study, by focusing on this, what I believe to be a flawed motion, may itself be flawed and may do more harm than good. Senator Kutcher's motion asks us to study the effectiveness of the federal framework on suicide prevention, which hasn't even yet been fully implemented by the Trudeau government. He's putting the cart before the horse. I would be all for the Social Affairs Committee studying the subject of suicide prevention in general. And by all means, yes, let's encourage the Trudeau government to fully implement this framework. But the motion before us could actually undermine the federal framework on suicide prevention, and I would hope none of us would want to do that. To what end, honourable senators? So we have to tear it down and start from scratch yet again? After 6.5 years of inaction from this Trudeau government, we can't afford further delay, especially when potentially the cost is paid with the lives of vulnerable Canadians. That is why I will not support this motion. Thank you.